Again, everyone, my name is Shanta Jackson, and thank you for joining us for our annual. This is actually our second time doing this for Mental Health Awareness Month. And the topic is Beyond Burnout, Real Talk on Mental Health. And thank you, everyone, for showing up and for being present. Okay. And before we get started, I do have a poll. I'd like to know, how are you doing today? How are you showing up today? And so the poll is launched. And one, if you're feeling sunny, feeling great. Two, partly cloudy, doing okay, good vibes. Three, cloudy, a little tired, but pushing through. Or four, thunderstorm, feeling overwhelmed, hanging in there. Oh, sorry. Uh, or five, hurricane mode, helping or help surviving. I'm not thriving. Sometimes that happens with us. So just how are you showing up today? And there's no right or wrong answer. It's just a real answer. Okay. So I'll go ahead and end that poll. Okay. We have some of us are feeling sunny. The majority of us are either partly cloudy. We're doing okay and we're managing the day, or we're feeling a little tired or mentally foggy, but pushing through. And some of us, and thank you for sharing and for being transparent. And some of us are, we feel like we're in a thunderstorm. We're feeling overwhelmed, stressed, or emotionally drained. And also, some of us are in hurricane mode, running on empty and trying to hold it together. Again, thank you for sharing and thank you for being transparent. This response is not only, or this activity or this icebreaker is not only that an icebreaker, but it also provides an opportunity for our facilitators as well to get to know you, and so that way, and to the best of our ability, to meet you where you are at. So again, everyone, thanks for sharing. Okay. All right. So who's in the room? We have, and this is based off of the survey responses yesterday evening. I know some of you all responded today, but for the most part, we have government sector, public sector, we have nonprofit, healthcare and public health, higher education, academia, and then we also have folks who represent human resources or talent management. And then we have individuals from the corporate sector and private sector. We have small business representation, and some of you identified as self-employed, K through 12 education, or other. Again, thanks for showing up and thank you for being present. And so, as far as representation, we have individuals. And if I missed you, and if you're not in, if you're not shown here, simply type your state in the chat so that way we can know who's all represented. But we have the majority of our participants are reside in Maryland. And then we have Washington, D.C., Washington State, Georgia, Indiana, Texas, New York State, Colorado, New Jersey, Nevada, Pennsylvania, and Virginia. Okay. And also in the registration question, we asked you about topics or questions that you may have. And so you shared concerns related to, and these are verbatim quotes, quick interventions people can do to manage high stress situations, ways to prevent burnout, or when to notice when burnout is kicking in, how we can hold the system accountable for addressing burnout in healthcare, to avoid burnout, how to be better about making, or excuse me, how to be better about taking time off from work or take a vacation and truly and fully relax, memory and sleep, and how to cope with working with clients in constant crisis. I am a case manager working with the homeless population. So again, everyone, thank you for sharing, and I'm going to divert my way to the chat just to make sure. So we have, yeah, Baltimore, we have Maryland here. And thank you for those that participated in the chat as it relates to the poll too. I see that we have Sunny and mostly Sunny there. Okay. And so before I introduce our speakers, our guest panelists here, I want to introduce you just an overview, just in case you're not familiar with Cause Engagement Associates. So we are we were established in 2015. We are a Maryland-based consulting firm, but we support clients nationally. And we support with socially conscious initiatives, including public health initiatives as well. So your social impact, your corporate social responsibility, anything socially conscious, and so that's your strategy, your needs assessment, your stakeholder and your community engagement, your program design, implementation, and evaluation. But in 2026, we introduced our new service arm of service, which is employee wellness and engagement. And it's based on the framework, which is a public health framework of the 8 dimensions of wellness. And what the 8 dimensions of wellness says is that there are these different domains or these different areas in our lives that we have to kind of focus and pay attention to help us to live the most balanced life as possible. So it's a holistic approach. And so your 8 dimensions include spiritual wellness, environmental, intellectual, occupational, emotional, physical, financial, and social wellness. And we support teams as small as 5 up to 500 plus. It's data informed. We do offer employee wellness surveys to where we are making data informed decisions based off what it is that employees say that they actually want, or in other cases, it can be your community partners or even the clients and patients that you serve. And those services are available both virtual and in person. And so with that said, that's it. That's the overview of Cause Engagement Associates. And now I would like to introduce our speakers. And so our team consists of associate consultants, various areas of expertise across the United States. However, joining us today is Angel Shannon, and Angel Shannon is a nurse practitioner based in Maryland. And so she will bring to us her clinical perspective. And then we have Walter Williams. Walter Williams is a licensed practicing counselor, and he has a private practice, and he also offers coaching as well. And he is licensed to provide actual therapy in the states of Wisconsin and Alabama. And then also joining us, she'll chime in, is Joanna Adlam. And she's our senior consultant in professional development. And she's also a certified coach as well, public health professional. And so these are the team members who are on. So I just wanted to kind of highlight them. And at this time, I will stop sharing my screen. And I will give Shannon and Walter the opportunity to introduce yourselves. And we can start with Shannon.
Hi, everyone. I want to echo Shanta in saying thank you so very much for choosing to be here today with us, spending your afternoon to talk about something that I think we're all deeply passionate about. I'm Angel Shannon. I'm the founder and executive director of SIVA Health and the SIVA Institute, where I like to say we put mindfulness and compassion in action to live longer and live better. Everything we do at SIVA Health and the SIVA Institute is grounded in the belief that an ounce of prevention is worth a pound of cure. And so my engagement here today with Shanta and my colleagues, Joanna and Walter, is rooted in what Shanta mentioned, the 8 dimensions of wellness and well-being. So thank you so much for allowing me to join you this afternoon.
Yeah, and I echo already what's everything been said. So thank y'all for sharing your lunch with us on this Thursday. We got some good numbers, 35. That's huge for a Thursday. So I'm excited. Walter Williams, mental health professional, owner, operator of Think and Grow. My focus is to help people restructure and reshape how they think so that they can see how it positively or negatively impact the body, but ultimately uplift the spirit, that mind-body connection, being grounded in mindfulness. And I believe if we just poke holes in some of the unhealthy ways we think or perceive, or even just shift our perspective, a lot of times it can change the entire situation. Not that the situation changed, but we change. And when we change, we can manage the things around us. So, um, live in Arizona, licensed in Wisconsin, Alabama. I know I'm all over the place, but I do some good work. But I won't belabor you with all of my background because I recognize the time and I want us to have some good discussion during lunch hour. So thank y'all so much for being here.
Yes, thank you. And so burnout is a term that we hear often, but what does that actually look and feel like in real life?
Walter, would you like to kick off?
Oh, well, I was hoping somebody would say, well, to get started. You know, burnout is something that we all experience in a variety of different ways. But in a nutshell, I call it, it's a trifecta approach where we're physically, there's something going on, emotionally, there's something going on, and behaviorally, there's something going on, right? Usually, physically, we're extremely tired, we're fatigued, we're lethargic, having physical symptoms from headache, restless, maybe not eating much, maybe eating too much. So we find our physical starting to slip away from us a bit. And we're not prioritizing ourselves to the extent that we probably need to. Emotionally, we're talking about symptoms of depression where your mood is low. You just don't, you want to be left alone. Sometimes that's okay. But if you want to be left alone for an extended period of time, it's a sign that something is going on, right? Anxiety, or we're overthinking, we're excessively worrying about things that we can't control. We start to get annoyed by the nuance of things that typically wouldn't bother us. And then behaviorally is when we start to withdraw, right? We start to isolate, we procrastinate on things that we typically are on top of. We start to avoid, right? We don't want to go to work. We don't want to open up the email. We don't want to make the phone call. Or even we start to cope in unhealthy ways where we rely heavily on substance use or other things to distract us from what we're going through. So burnout is this trifecta of approach where physically, emotionally, behaviorally, we just start to see small nuance, small changes that impact us, that leave us depleted at the end of the day. But that's how I was summing up. Angel, I don't know if you would add anything to that.
Yes, all of that. And then I'd just like to add from a clinical perspective, what shows up in the on the clinical side. So everything that Walter just described, mental health symptoms, so depression, anxiety. But one of the biggest things that I see, difficulty sleeping, afternoon energy crashes, feeling like I just can't stay awake. I wake up, bright, fresh, ready to go, and a half an hour later, I'm at my desk and I'm just exhausted. In the clinical setting, we've known this for years as adrenal fatigue. There's argument on both sides, but at the end of the day, it really comes down to what's happening in three areas of our body and brain. So it's the hypothalamus, it's the adrenals, it's the pituitary. So there's disconnect in all of that on the clinical side of things. And that's where we begin to see some of the physical symptoms that Walter was referring to, with the energy levels, the difficulty focusing, the energy crashes, the maybe even weight gain, sometimes even unexplained weight loss. So it is for sure a trifecta, and it becomes this sort of vicious cycle. One thing I do want to point out about burnout, and I can share my screen on this if we have some time, is that a researcher identified that burnout is not just one thing and it's not one stage. Burnout exists across a continuum. So you can start here with the overworking and giving your all and staying late in the evening and such, and then go to the stage of withdrawing, as Walter said, and I'm just not going to stay, calling out, and because you're so exhausted. So there is a long continuum, and there are actually 12 phases that this researcher identified. I'm happy to share that on screen if we have some time.
We do. And while you're doing that, I want to know just by emojis, or write in the chat. who can relate? Who can relate to the trifecta that Walter mentioned, the physically, emotionally, behaviorally, or some of those physical symptoms that Angel referred to? Okay.
Thumbs up. Yeah. It
Mhm,
happens to us all. It happens to us all.
mhm.
Into what Angie was saying, I think we start off with in the optimistic space. I'm gonna go hard. I'm gonna work. I'm gonna put it all. I'm gonna show
Yes,
up. And it becomes these invisible narratives that we're operating by. And I think burnout happens even then the word is slow, right? It's like a slow drift. And we may not recognize when it's happening, but over time, if we keep going hard, keep going hard, keep grinding, you start to grind out. So, Angel, I love how you put that.
yes. Thank you. I'll stop sharing this. Mhm.
Well, let's walk through it real quick. So 12
Cool.
phases of burnout, just by number.
Sure. Absolutely. So in the beginning, excessive ambition, as Walter just said, I'm going to go hard, grind, burn the midnight oil, all this kind of thing, working harder, longer hours, and inability to step away and turn off. Oftentimes feeling like if I don't do it, nobody's going to do it. It won't get done if I don't do it. Who else is going to do it, right? So you're really putting it all in. Phase three, you start neglecting your personal needs. So, gosh, I used to love going to play golf on the weekends, but I really do have to work on this. I used to love swimming. I really do need to stay late, right? And then it's displacement of conflict. So, at somewheres around stage four, that self awareness becomes impacted. Maybe family or friends are saying, listen, I noticed that you're just not coming to golf anymore. You're not swimming with us anymore. Well, that's not my fault. Irritability, jitteriness, displacement of conflict. Revision of values is when we start saying, some of those core values. Maybe you're a person who really does value family, but you're starting to put some of those core values on the back burner, neglecting your health, maybe not going for your physical appointments and things like this. Denial is a big stage of this. Family members will often say, what's going on? Or friends are saying, we're missing you. And, instead of recognizing and saying, yeah, I really do think I'm doing too much. It's no, no, no. I'm working towards this project. I'm going to get, promoted. That denial can be strong in there. And then as you get a little bit further down into the continuum, there's the withdrawal, there's those behavioral changes that Walter was talking about, where there may be some signs of depression, there may be some difficulty sleeping, more depersonalization, feelings of worthlessness and hopelessness. And what I really find in my own clinical practice when patients have come to me is 10 and 11. People don't seek out help and resources early enough often, and not through their own fault, but just, lots of times we just think we're okay. So what I see is often the 10 and 11, the inner emptiness and the depression, when people just feel like that worthlessness, like, what does this mean? What am I doing? I'm no good. They often come to me at that 11 and 12 looking for medication or just something to feel better. But at any given time, we can bounce between any one of these 12 phases.
Okay.
Well said.
Thank you.
Mhm.
Thank you so much.
You're welcome.
Okay. And so, Walter, number 8, overt behavioral challenges. Let's talk about human nature and the laws of human nature. In addition to depression or maybe scaling back, some individuals may, with burnout, with I guess with that, with the emotional or I guess the behavior, should I say, with the behavior, it may be in a different form. It may be in a form like they may be irritable, or they could be become aggressive, or maybe even bullying, or just like outbursts. And so with that said, what recommendations or strategies could you provide that could help people to help with that emotional awareness, that assessment, and then that regulation in the moment?
Yeah, good question. One, I think we have to have a honest conversation with ourselves and realize that, recognize that we may be over functioning, maybe over committing, and may have just bit off more than we need to chew. I think we're in a time where it's just my opinion here, where it seems like we're in a rush to get somewhere, but we ain't going nowhere fast enough, or this idea that we're going to miss out, or that I'm not going to get my time to shine, or I may not get that big thing. And I think it calls us to create these belief systems that we begin to operate by, because behind every action there's a thought, and the thought can be quiet or it can be subconscious, and it can be causing us to show up in a way that doesn't align with our values. So a lot of clients that I work with, I one bring awareness to it, and then I help us to think about what values do we live by, what values do we operate by, right? And then once we're able to identify those and unpack those and define them, because it's one thing to say, a value of mine is peace, but what does that mean, right? Because what peace look like for me may be completely different what peace is for you. So being able to define what that means and then begin to align our actions with how we defining it, right? And if we could begin to create opportunities of peace in our day, whether it's a 5 minute walk in the morning, a 10 minute walk at night, whether it's during lunch, you join something like this to have your mind and your body and your spirit fed. Um, because it allows us to begin to think about ways to no longer operate from this hyper awareness, if you will, that we have, or this need to be on. So I would say slow down, realign with your values, know why you're doing what it is you do. I think sometimes we just do stuff just to be doing it, but don't know why. If we know our why, I think how we show up and what we do behind that begins to show. And the results will always follow 100% of the time. The thing is, we want it to be immediate, but we don't trust the process. And we may plant a seed today that may not sprout up for a couple of weeks from now. But that's when we have to ask ourselves, are we living by faith or living by fear? And if we're being led by faith, it allows us to keep showing up in the work that we're doing while still saying, hey, I just need a break. I just need a moment. But those are some things I don't want to go on and on. But those are some thoughts that come to mind for me to that question.
Okay.
Hope that answers it.
We do have a question from Janine. I see your raised hand, so I definitely want to address Janine. But before I do, I also want to add that, like sometimes in the moment, time gives us perspective, right?
Yeah.
And so maybe if you are angry, or if you do if that's how you feel, that's how you feel. So draft that email. Tell them off, but just don't send it, okay, y'all? Just don't send the email. Just don't do it. But go ahead with the process. You might want to, you might type it, write it down, and say it. That doesn't mean that you have to communicate it. And then, and maybe, if you, and chances are, if you give it some time, again, time gives us perspective. If you give it some time, you may think a little bit rationally and say, you know what, it's best for me not to approach it this way. I was in the moment. I was in the moment. Okay. So
Love that.
with that, so that's my 2 cents. And Janine, feel free to unmute yourself if you like.
Yes. Hi, how are you? Can you all hear me okay?
Yes, we
Yes.
can.
Okay.
Yes.
I thank you all for this space. I just want to note, Walter, as you were sharing, well, first, Shanta, as you mentioned, draft the email. Don't put the sender in there because you might accidentally hit send. And then for Walter, when you were mentioning about name it peace, what peace looks like, something that also came to mind is supporting people and naming if they need support along that journey. And that's
Yeah.
something that, maybe if you need other people in your life to help you, or maybe you don't, right? And so, what does it look like to really create a comprehensive plan on how to obtain those things? And that's something that I held space with folks at my church when we talked about, what does mental health mean to you? And then we ended up asking folks like, well, what support do you need along the journey, and do you know how to get there? Because sometimes we want something, we need something, but sometimes we don't know how to get there, and we need people to tag a friend in. So I just wanted to name that. So thank you all for what you're sharing today.
Absolutely. Thank you. That's a great point. Very good point.
Yes, it is.
Yes, thank you. And before we move on to mental health myths and misconceptions, I do want to highlight. So I did look at some of the questions, and I have the questions written in front of me. But if I feel like they're not addressed, that you audience members or participants that you placed in the registration, if I feel like it's not addressed, then I'll bring it up. And if I don't bring up your comment, it's because we've talked about it in discussion. But Angel, another attendee, shared to avoid burnout. They want to know like how to be better about
Mhm.
taking time off from work, going on vacation, and then actually truly fully relaxing and being in the moment of vacation. Any just quick tidbits there, and then Walter before we move on.
Yes, that's a wonderful question. I live by this principle that if it's not on my calendar, it doesn't exist. I really do believe that it takes intention and it takes us taking that action and saying from those core values that, listen, I'm not a human doing, I'm a human being. I deserve an opportunity to rest, renew, reflect, relax, reclaim my time. So for me personally, I began this practice of every year, the start of the year, just literally looking at my calendar and really just placing intentional, starting with just one day, intentional rest days, intentional thinking days, that I do nothing for that one day each quarter. That's where I started. So I think that just making that intention, setting that planning time to plan, so a planned time to plan, and putting it on the calendar, putting a pin in it, claiming that if you're working in a workplace somewhere where you have to submit that to an HR person, submit the time, put it in, go all in on it and claim it as yours. Because once you put that stake in there, highly unlikely you're going to back off of it. But the more you think about it and say, gosh, that's just something I need to do, you're likely not going to do it. So claiming it from the very beginning, and you don't have to wait until the beginning of the year. You can start today. You look at the rest of the year and say, you know what? I'm going to take these days, those days. If you're all out of PTO time, it can be on the weekend. But somewhere on your calendar, there needs to be an appointment for you because you deserve that.
And I'm that other voice. I'm that funny voice on the other head, and on your other shoulder. Like you have those two personalities.
Mhm.
They'll be all right. They can wait. It can wait. They'll be
It,
okay.
it
Um,
can wait.
and so this is also just setting your boundaries. And Joanna talked a lot about setting boundaries in some workshops that we're currently doing for some clients. Um, if you're on vacation, of course you have the out of office email, but then those apps, the even your for work, your notifications, I think that's the time where they're not, they're literally deleted.
Mhm.
And then when you get back home, then you can turn it back on, so that's just what I have to add. Actually, let's pause here. Julie, I saw your hand up. It's down now. Did you still want to pose a question or
I would,
a
yeah,
comment?
thank you. Appreciate it. I'm so glad I could join that. This is right up my alley, personally and professionally. So thank you, both for your work in this area. I unfortunately experienced burnout, ironically, at a behavioral healthcare company of all places, serving, millions of health plan members and then burning out myself. Looking back at your 10 stages, or phases of burnout, I feel like 1 through 4 in most organizations are actually valued, right?
Mhm.
When you start to have that excessive ambition, start working harder, neglecting your personal needs, even displacing conflict for certain cultures that aren't very good at conflict resolution or harmonizing. Um, what are your thoughts on companies recognizing that
Mhm.
those initial 4 phases are signs, early warning signs, as opposed to
Mhm.
something to applaud?
Mhm. That is a wonderful question. And thank you for asking that because I too worked for a behavioral health organization where it was the exact opposite of what behavioral health should be for the employees. First and foremost, I think every company, whether you're a company of one or a company of 10 or 10,000, you have to create a culture and an ethos of wellness. It's not enough to just have wellness classes. It's not enough to bring in a wellness coach. It's not enough just to put a sign over the door and say, whatever it is, whatever slogan you have, there has to be an ethos. I'm a big basketball fan, and Shaquille O'Neal said something the other night. 15 guys have to believe the same thing in order to win that game. Everyone in that organization has to believe the same thing. They have to believe that an ounce of prevention is worth a pound of cure. They have to believe that we are human beings, not human doings. It takes people to step up and say, we can't operate this way because we have to be able to resolve conflict better. So it starts really, it really is ground up work and changing the ethos and change and realizing that a company cannot thrive with unhealthy
Yep.
individuals. It just doesn't work that way. Individuals and the company are directly linked. It's one ecosystem. It's not employees and company. It's them together. So I think that making that connection and helping organizations understand that this is directly related to the financial incentives that you say you want to achieve. There's no way you can grow and thrive as an organization when people are unwell, when they're out on disability, when they're out on, leave because of mental health issues or bullying or things like that. So in my work as a clinician, I try to tap into what I know their core values are as an organization. They want to make money. I understand that. Every business exists to make money. But what I help them understand is that you're not actually making money, you're losing money by not changing this ethos that you have here that prioritizes profits over people. That's just not going to work. I've been a clinician for this is my 33rd year, and I've seen companies absolutely drown and die and go out of business because they don't understand that employee wellness and that ethos matters to their financial bottom line. So that's really my focus as when I go into to provide programming is under helping them understand that. And then starting really small with team enrichment activities, individual activities, bringing in individual resources, individuals like Walter, myself, other professionals who really can do that one-on-one work. Some organizations like to say we're a family. Well, not necessarily. We're all individuals. So we have to meet each individual where they are.
Thank you so much.
You're welcome.
Yeah, that's a
I,
good question. Yeah.
I,
But I'll hold my thoughts. Go ahead. Go ahead.
just a follow-on to what you said, Angel. In your experience working with organizations, have you found pretty quickly some leaders who just don't get it or possibly aren't even brave enough to go there and they'd rather just churn and have the turnover and not face the issue head on? And then what do you do? Do you just say, we're not a
I
good
find
fit?
I find the one person. There's always
Okay.
one person. All I need is one person in an organization who gets it. And the bigger the organization, the greater the likelihood that I'll find that one
Yep.
person. And if it's not a big organization, even if it's a small organization, I go back to that organizational leadership and I ask, why are you here? What brought you here? As Walter was saying, when you tap into that why
Hmm.
did you come here? Yeah, they offered you whatever salary and this, but there was something bigger than that that brought you here. So when I tap into, and I do this with my patients, tapping into their core values, their bigger why, I'm able to get in there and figure out what exactly is holding you back. I don't want
Hmm.
to go too far, but we all have mental saboteurs. We all have that little thing that's that little person on the other shoulder, that hypervigilance, that victim, that the whatever it is, we all have it. So whatever their saboteur is, it has them thinking that they have to keep going with the flow and not go against what they know is not healthy for the organization. I try to tap into that as well. But overall, all I need is one person.
Awesome.
Perfect. Thank you. And so, speaking of workplace accountability and support, uh, this is for the both of you, but Angel, you pretty much answered. So, I want to, at this time, defer to Walter and then Joanna, if you can join us in this response. And so, one of the attendees asked, how can we hold the system accountable for addressing burnout in healthcare? So, from your perspectives, what responsibility do workplaces, leaders, and systems have in preventing burnout rather than placing the burden entirely on individuals? And we'll start with you, Walter.
Yeah, I think Angel gave some really good insight there already, but I'll just make a couple of comments. One, I think finding ways to collaborate with our employers. I think a lot of times we view the hierarchy, somebody's the employer, someone's the employee, but we all work together, right? We are part of the same organization as individuals. So instead of how do we compete or how do I, talk smack about the leadership or ridicule them, but how can I begin to collaborate and work with them to bring awareness and attention to what's going on? Because sometimes as leaders, when you're so far removed from the boots on the ground work and doing the hand-to-hand combat, you can lose sight of what's going on. And sometimes you need people to come back to say, hey, this is what's going on over here, and we need to make sure that you're aware. And here are some things that we can do to move this along. I think sometimes we expect leaders to have the answers, and really it's the folks who are doing the work who have the answers. So, in thinking about ways to move and hold people accountable, consider ways for collaborating. How can we work together to disrupt the culture? And Angel hit that right on the head. One, two, I think another thought is holding them accountable to, I think Andrew put it, not putting people over profit. And I like to think of it as well, not chasing paper, but chasing purpose, right? Because when we start to chase paper, the paper keep running away and we get the money, but we're not fulfilled. We don't feel satisfied. We still feel empty. But when we operate from a place of purpose, now we go back to our mission. What is our mission statement? What do we say as a company is what we live in by and upholding collectively, right? And how does that show? So when we begin to practice what we preach from the leadership standpoint, we see the ripple effect right away. But I think holding our leaders accountable by collaborating with them, not bashing them, by saying, hey, here are some things, some gaps I'm noticing, and here are some solutions that I can offer or that I suggest versus just complaining. Because sometimes when you're just offering complaints, it's like, well, you just complaining just to be complaining. What are we going to do about it? And if you can come with some solutions and some ways to strategize and work, I think it helps to move folks along in a productive way. And know that you may not see the change immediately, but it's the consistent effort, right, of showing up. And that allows us to hold our leaders accountable. So those are my thoughts on that. I don't know.
Thank you for that. Excuse me, Joanna. Joanna is an associate consultant here with CEA, and we're actually partnering, working together with a local health department, and we're providing a series of employee wellness and workforce development. And so that includes the topic of stress and burnout, more in depth and more practical, but then also dealing with folks and difficult communication. Joanna, what role should workplaces and organizational leaders play in supporting employee mental wellness, emotional well-being, long-term health? And the reason I'm asking you is because what I'm looking for is some of those practical, like some notes, some of those practical strategies that you recommend and that we have been recommending with our clients.
Yeah, I think that's a really great question. An organization making a choice to have a culture shift and to really promote a culture of wellness, just like Angel and Walter was talking about. And some direct strategies, or for example, is very simple, having workshops, just like we've been hosting, right? Having everyone come together in a shared environment, safe environment. For example, we have not been recording sessions, so everyone feels safe. They feel like it's a trusted environment and it's a place to take the mask off. So things that you may not have necessarily shared with your colleague in this space is a little differently, because you're starting to witness that your workplace is prioritizing your wellness and are taking actions to demonstrate that to you. So we've been doing workshops. It's been amazing. We've been talking about how to manage stress, burnout, energy at the workplace, how to communicate effectively in challenging interactions. So these are actually really practical ways that you can get the support that you need, but in a shared environment. So even if you didn't want to invest in employee coaching and really just wanted to start with what's something that's really simple that we can do, there's the workshops, there's trainings, there's safe spaces, group coaching sessions where everyone can actually see, hey, I'm not in isolation. Someone else is, going through the same thing, or hey, I'm feeling that tension too in my area, and how do I navigate that? So I think that accountability and starting to make those small actions, just like Angel said, like what are some, small things that we can do to actually start demonstrating to our employees that we are serious about promoting a culture of wellness.
Perfect, thank you. And then I also, if I'm thinking about, I'm putting myself in the place of a decision maker or a manager, or a leader within the organization. Well, all of us in our, even if we don't have the title, a lot of us, we're all leaders here for one. But if you have that, that formal responsibility, that formal title, it's also, giving yourself some grace, and just understanding that as professionals, we're all learning here. We're all growing. We have different personalities. You can take a lot of different classes, but sometimes things just happen with the experience and you have to put things into practice. And so you have the resources and the people around you. It's not necessarily about how you're going to get it done, or what to do next. It's sometimes it's like, what resource do I have, or who do I know that can support me in that area? But then, so give yourself some grace, acknowledge the acknowledge the needs of people, but then also like give accolades as well. Um, how many people here feel recognized in their day to day and work? Show of hands, or in the chat. Do you feel recognized? Do you feel acknowledged at work? Okay. All right. So, oh, okay. We have some. And I don't know if there's a thumbs down emoji or not, but how many of us do not feel acknowledged or would like to be acknowledged more? Okay. So something just as simple as that, just acknowledging people like, hey, I noticed that, you spent the extra time on this, or I really like the report, or thanks for taking time to talk with that patient, that client, or helping me to complete this task, just those acknowledgement type things, or even setting the culture of it could be incorporating things into your meeting agendas, and or even just the workday, the schedule, and encouraging your staff not to have lunch at their desk, encouraging your staff to not check emails at a certain time, but then also for you not to send emails at a certain time. Draft the email, but don't send it, or schedule it. It's not about being in distress, or you're, suffering burnout, but sometimes you can unintentionally cause stress to your staff and your team. So, just kind of being mindful and treating others how you would like to be treated. And then just also recognizing that some of us are caregivers, some of us are recovering or healing. We have taking on responsibilities. Think about the economy. Some individuals have lost their jobs. We might have an unruly teenager at home, or someone might be newly diagnosed with a medical condition. So we're living here, like real life. We have bills, we have certain things. And so just to keep that in mind, just to keep that in mind. So those are some of my tidbits, some of my points, but thank you so much, Joanna, for providing that insight. So I want to defer to, I'm trying to get there, mental health myths and misconceptions. But before I do, Aaron, you have a question or a comment?
I do have a question. Thank you. Um, Good afternoon, y'all. I just want to thank you all for your expertise. I want to ask about protective steps to prevent burnout. So I work with law enforcement. That hyper awareness and hypervigilance that can lead to burnout is a needed tool to protect them, but that takes a toll.
Mhm.
And so I'm curious your answer to like what actions can an individual take while on duty to support their wellness and protect themselves from burnout?
Thank you for that question, Aaron. Let's let Walter respond to that first, because I know that Walter has previous experience working with law enforcement, and actually has developed some proposals to support local law enforcement as well in that area. So I'll pass it to you first, Walter.
Yeah, thank you. Thank you. And great question, Aaron. My initial thought, something I'll call it a 10% rule, a 10% principle. And I think about it from many different fashions. And if you are someone of a Christian belief or religious belief, we learn that, right, you give a tenth or 10% of your offering on what you have to the entity or the religions or the practice that you believe. And I think that being that we are an expression of a greater power, of a greater being, that in a way we should give ourselves 10% as well. So for a lot of individuals in law enforcement, and really in any capacity, but particularly our men, when I lock in on some of this work, is just trying to think about how do I give myself 10% of my day, whether that's On the front end of the day in the mornings where you have a moment to yourself to not engage or feel like you're rushing to the day, but allowing the day to come to you. Maybe it's during the workday where you disconnect from all technologies, go for a walk around the block, have your lunch without anything to be, feeding your mind things that may not be helpful or productive. Finding ways to take care of the body, right? And thinking about the routine, whether it's in the morning, midday, afternoon, but finding a way to express some of that energy. Because as being in a servant's feel, right? We consume a lot, and not all the time we can talk about it or even have the words to express it, but the body keeps the score, right? The body knows, and we have to get that energy out some way, somehow. So just finding ways to relieve some of that stress physically, I think helps us to unlock how we're feeling, even if we can't always verbally express it. And then the last piece I'll say, just really just trying to find some community space, as Joanna was getting to, people that gets it, that understands it, and that you can process and unpack what you're experiencing and going through, and knowing that you're not the only one. Because sometimes it can feel very, very isolating to deal with a lot of the things that, in this hoping field that we take on. And then just having somebody to chat with. I think to dump what we carrying onto someone else, I think helps us to unload so that we can reload from the work that we do and the people that we serve. So just trying to find systems for ourselves, man, that I think help us to sustain as we carry the weight of the world and others on our shoulders on top of the stuff we're going through ourselves. So that would be my quick answer, if you will, to what you're asking. Hopefully that gives some insight.
Yes, and before I pass it over to Angel, Walter, as a protective step, so usually some folks they think of mental health where it has to be like in a crisis mode.
Hmm.
As a protective step, is that something that could be offered or recommended? Is that something within the field that's practiced in law enforcement as a protective step or protective
Absolutely.
measure?
Absolutely. I think someone said it. Oh, we don't have to be in crisis to engage in spaces like these, or with a therapist or a nurse. I think it's always good to be proactive, right? And preventative. And if we can be proactive, I think when things happen, we've already been able to fill our cup or fill our bucket to an extent that we have something to lean on. It's not if the stress happened or if the crisis is when, because it's going to happen in some form of fashion. But I think engaging in spaces like these helps us to reinforce the thought process, right? To reinforce beliefs and ideologies and challenge behaviors so that when we in game time mode, we got something that we can pull from, right? And I encourage a lot of my clients, sometimes they be like, I'm not in crisis, I don't have nothing to talk about, or we always got something to talk about, right? And even if we don't, how do we maintain where we are, right? How do we double down on the growth and the progress we're making? So yes, it is a protective measure. And I think again, as men, and I'm just picking on us men who are in the helping field, we need a place to dump because we always put our cape on and run in the fire. But who put the fire on us? Who put the water on us when we are burning and we're on fire? So, yeah, that's my answer. Long-winded. Sorry.
Angel, short-winded response.
Well, I just want to acknowledge what Aaron, I think, asked about hypervigilance, because there is a physiological perspective to that parasympathetic versus sympathetic nervous system. So those who are, and I don't want to be too long with this, but from the clinical perspective, I would always recommend, never assume that something is purely psychological. There could be a physiological and biological component to it also. Is it blood sugar imbalances? Is it that I'm working shifts and I'm up all night and there's a cortisol imbalance? There's lots of other things that we should investigate from the clinical side of things. So I would just say all of the things that Walter identified, but then bring that into the clinical space with your healthcare provider and mention that, I just can never turn off. I feel like I'm in overdrive. I have caught a lot of diabetes. I've caught a lot of thyroid issues. I've caught a lot of things in the clinical space that explains why people are feeling the way they feel. A body in motion stays in motion. So don't, please remember to have these same mental health conversations in the clinical place space with your primary care provider, because that's where a lot of those important tests can be done, and in further investigation of a potential physiological or biological concern.
And the program planner in me says this is a great opportunity to combine both the therapy, the emotional and mental wellness component with clinical. And if you all have like maybe this is something you can take to your HR department, and this is for everyone. To where is there an opportunity for us to kind of create, even if it's kind of like a mobile concept, but like some type of clinic or some ongoing, not just a one-time thing, but something kind of like ongoing, where we can incorporate both mental health and then also that clinical aspect as well. A lot of you all have if you your benefits providers, they probably have some allotted budget that a lot of the employers are not taking advantage of. And so it may be an opportunity to collaborate with them. But I also understand that some of the healthcare providers is a lot of administrative responsibilities to do some of the programming. In addition, and then also with the HR team or your management team, there's also your responsibilities that you have. And so there is an opportunity to, and I would offer something like this, and I'm just kind of brainstorming here, but this is something that cause engagement that we have the capability to do to help to coordinate that, to take that administrative burden off of both hands. So Angel, I definitely, so we've talked about burnout, chronic stress, and emotional fatigue. The mental health myths and misconceptions, I tried to throw it in there a little bit when I was responding with Aaron. But I also want to, Angel, I want to focus on longevity and like a lifelong wellness
Mhm.
and how stress, burnout, and even just your brain health or your cognitive health,
Mhm.
how all of that's related, or just like any insight that you can share with folks, some key takeaways as it relates to that topic.
Sure. One of the things I fix or work on fixing with my patients, clients, classes, anything, the number one intervention that I work on from the very beginning is sleep. The reason why I work on sleep first and foremost after doing labs and things like this is because sleep is the time that your brain clears itself out. You have something in your brain called glial cells, and basically they're like little brooms. They sweep out the debris, they get old memories, they filter waste, all of those things. They regulate hormones. So if people are not sleeping and get quality sleep at night, that's going to cause all kinds of other problems during the day: hypervigilance, restlessness, fatigue, depression, things like that, sadness, things like this. So I try to focus on that from the very beginning. Lots of the research studies have even indicated that lack of sleep or poor sleep is directly linked to some of the neurocognitive problems that we're seeing arise in the rise in Alzheimer's disease, Parkinson's disease, and dementias, all of the dementias across the board. So I would say the number one thing, focus on, that parasympathetic nervous system activation, which is all of your relaxation practices, breath work, yoga, Pilates, things like this, walking, journaling. But number one intervention, working on getting quality sleep, because that's when your brain is helping itself.
And try. It'll be hard, but just, and you might give in a little bit, but maybe at night, maybe put your phone in a different room or maybe in the bathroom somewhere nearby and to where it's not near you. And maybe cut off engagement, like that stimulation from like social media, television at a certain time to give your mind, your body some time to kind of like tone down and relax and prepare for sleep. And then feeding your subconscious mind and saying, you know what, I'm gonna have a good night's sleep. I'm gonna sleep well. I'm gonna sleep well tonight. And you never know, it might happen. And so, Walter, final key takeaways.
Yeah, what we fix our mind on, what we meditate on is what we eventually become. And if I can encourage people to feed the side of their mind, to feed themselves with and consume information that is lovely, that is true, that is peaceful, that is kind. I think we're in a time where we're being fed a lot of information that has us in a state of fear, and it's hijacking our bodies and it's hijacking our spirit in such a way. So if we can quiet some of that noise and really go inward and in or develop language that we can suggest to ourselves and offer to ourselves and sit with during that sleeping period. Research shows that when you are in that sleepy state and you fix your mind on these things, how it really begins to feed into your subconscious mind. Because a lot of our actions and what we do is it comes from our subconscious, which means it's happening automatically. The breathing, the blinking, those things just happen automatically. But if we could be intentional about that, I believe that we will surely see a change in how our bodies begin to evolve. We'll see a uplift in our spirit. We'll be more determined, motivated, encouraged. But we're not looking externally for something that we already have on the inside. So my encouragement is to fix your mind on what is true, what is lovely, what is peace, what is kind for you, and allow that to comfort you and greet you because it's all there. It's all there, but it's up to you to be able to pull it out.
Thank you so much. Thank you, everyone. We are at the conclusion of this webinar slash panel style discussion. And if you want to get in contact with Walter directly, his information is on the screen. You can scan the QR code. Again, Walter is an associate consultant with Cause Engagement Associates. And so that means if you want to, scale up, he's a member of our team. So you can contact him directly or you can contact Cause Engagement. But uh, a life coach, and then licensed in Wisconsin and Alabama. And then Angel, if you have any questions or answers and for to keep in touch with Angel, please do scan that QR code. And Angel, again, she has her own private practice and consulting, and she also offers retreats as well. I know she has an upcoming one in Costa Rica for women over 50. Am I correct, Angel?
Yes.
Mm-hmm. And so that's and so in your spare time, everyone research blue zones. And so and that's what Angels Retreat, that's the focus area or the theme. And so again, thank you, everyone. We are Cause Engagement Associates together, and we look forward to continuing to engage with everyone. We will send an email asking how we did, and so please do share. And thank you. I'm looking at the comments in the chat. Yeah, thank you, everyone, and make it a great day. And we're really good on time, so I appreciate that. I'll give you back your 1 minute. Thank you, everyone.
Thanks, everyone. Thanks for
Thank
listening.
you.